Okay, you're live. Thanks.
Thank you. Evening, everyone. I'd like to call to order the Public Safety Committee of Monday, May 17th at 5:30 p.m. And having done so, do I have a motion to approve the minutes from the April 19th meeting?
Motion to approve.
Second.
All in favor?
Aye.
They're approved. We do not have any public comment in queue, wasn't expecting any. And public generally knows that they are welcome to connect through public meetings at rockyhillct.gov email and to get credentials for any Zoom council meeting or subcommittee meeting. Moving forward to department updates, and we can start with fire. Assistant Attorney Dave Promus, I believe, is giving the report. Chief Gary, he's out of town. We'll move up.
I think Dave's on mute.
Dave's on mute, or is he in the car?
Dave, this is John Murphy. Do *6 on your phone to unmute yourself.
6. Okay, can everybody hear me now?
We can,
Yes.
Dave.
Okay, sorry. Our report for April 2021 is incidents we responded to in the month of April were 44, for a year-to-date total of 205. Year-to-date total for April 2020 was 168, so we're a few ahead of last year. Training hours recorded for the month of April were 367 for a year-to-date total of 1,340. We actually are a little ahead of that from 2020 of last year. We had 1,285 hours. Firefighter injuries reported for the month of April were 1, year-to-date total of 2. Our staffing is still at 74, with approximately 64 active members. The rest of our report is really basically all in everybody's packet there. The stuff we did this month, we placed 1 new member online in April. We have 3 prospective members in the application process. We had press coverage for a joint RHFD Harvard Hospital paramedic drill, EMT, also involving Lifestar. April 4th, we did a press release for the Stevens School update for the incident at Stevens School. April, we did the American Lung Association Firefighter Climb for Air. And we had a public information training course in April 10th of 2021. Health and safety, we're returning to in-person training. We started that in the month of April. We're still continuing in May. We've actually have the SCBA confidence course / maze. That's a trailer that's supplied by the State Fire School. Our accountability system is here and been installed. Administrative and operational COVID-19 directives have been updated. Facilities and fire blast, like we said, the fire blast trailer is here. It is on our training ground. 8 sets of fire gear were delivered and fitted, and the PFAS foam is being presently turned back into the take-back program through the state. And approximately 90% of our SCBA air tanks have successfully been hydro tested. And the town-wide GIS hydrant mapping system has been completed. We're putting a few more tweaks into it, and it should be online in the next couple days.
Thank you.
That's all I have at this time.
Turning to questions from Councilor John Emanuel.
Yeah, Ed, I was just looking at the inspections, and maybe we could reach out to the fire marshal to attend at the next meeting. I'm just curious. And Dave, I'm not sure if you want to pass this along to Rich. I was just curious about Century Hills there were like 6 violations. I was kind of curious of what's going on there. So maybe next
I'll reach
meeting.
out,
Yeah, maybe
I'll
next
reach out
meeting.
to Rich.
Okay,
yeah.
all right, thank you.
But John,
John Murphy, if you could have him included on the next invite.
I think
Okay.
he is, Dave. I think he is normally.
He wasn't, I asked him if he was coming tonight and he said he never received an invite.
okay.
All right, we'll look into
But,
that.
John, the town is sort of pursuing through the court Century Hills on a number of violations, some related to the fire marshals, some relating to building codes, and some related to like zoning enforcement and so on. So
Okay.
that's just a piece of it, but the town did file a suit against them in the past week or two.
Yeah, it might be a good idea to get maybe a summary at the next meeting of what's going on, because if there's a major incident there and then we learn after the fact that these things were going on and the committee wasn't informed, it may cause a problem. Thank you.
Okay.
Is that it, John? Counselor Pankaj Prakash? You're muted.
No, thank you. I said I'm good for now.
You're good for now. Dave, does the injury count take into account this weekend's fire?
No, it does not. This weekend's fire will be included in May's report.
Okay, yeah.
This week, the injuries were, I'm not going to call them minor, but the injuries were heat exhaustion / dehydration of one of our firefighters from working inside and working the exterior. He was held overnight because they did blood enzyme on him, and there were some elevated levels, but it turned out that he did not have a heart attack. But they're holding him off for further evaluation by a cardiologist. And the second firefighter was a minor pull or strain or sprain. They don't believe that he tore anything. It was a shoulder injury. He was pulling the soffit around the house, and that's when he either hyperextended or whatever. I'm not being a medical professional. I can't really speak to that, but I have spoken to the firefighter's father and the firefighter that night at the scene, and he was treated and released. The other firefighter was treated and held overnight and then was released later in the afternoon the next day.
Welcome. The mayor is just logged in. Dave, for those who may have heard, I mean, it's so I realize it probably will be on next month's report, but you speak of injuries and complications from an event that happened over the weekend. And if you could just give us a bit, since it's probably on many people's minds, of what happened on at the fire.
Okay, yeah, basically we received the call at 16:32 as a fire alarm. Our first arriving piece of apparatus wasn't a capital piece of apparatus, it was our duty officer. The call came in at 16:32. He was on scene at 16:39 with a heavy fire showing out of the garage in the CD side of the building. Heavy smoke, heavy fire. And our first arriving capital piece of apparatus was engine 2, which arrived on scene at 16:44. Car 5, who was the incident commander, who assumed the command from the person that established it at 16:32, he was on scene at 16:41. Upon my arrival, I arrived. I can look it up. I can't give you an exact time right now. I arrived probably 15, 18, maybe 19 minutes into the call because it came in as a fire alarm, and we already had 2 deputy chiefs on the air. So I was monitoring, and as soon as I heard there was heavy fire, I started responding because I knew the chief was out of town. Upon my arrival, I spoke with the incident commander. He told me what he had, and I left him in command of the call. I mean, he was doing what he could, and I don't think, all in all, you can always look at something in hindsight and think you might do something better. We had we had a lot of apparatus there. We had a lot of manpower that we could muster on a Saturday afternoon at 4 something in the afternoon, and there was a lot of fire. So all in all, I mean, anytime you lose a structure, it's never a good day. But there was nobody in the structure. When we first arrived, we got conflicting statements from the neighbors that said that there was somebody that was living there. The person that was living there had passed away about a month and a half beforehand, but that neighbor was not aware of that. So the incident commander, when he was told there could be somebody inside the building, did a primary search, pulled a crew off of the garage to do a primary search. Life safety is always paramount to property. So I would never question that decision. It was eventually learned that there was not somebody inside. And at that time, we were seeing elevated temperatures in the attic, and we decided to pull everybody out of the building and go defensive.
So we lost the house, no lives lost, and some minor injuries, at least at this juncture, sound like some minor injuries to firemen, and we're all set. Any questions?
I mean, it's anytime you have a major structure fire, you basically, I'm not going to say you didn't lose the house, but basically if you have any kind of major fire within a house, the family that lives in that home is going to be out of there for 3 to 4 months, 5 months. Unfortunately, this one, with the amount of fire that they had, and I mean, I'm not in charge of the fire investigation, so I don't know what started it. So, but with the amount of fire that was evident there, we are going to be having a critique on it in 2 weeks. For the amount of fire that was there, it was very hard to contain. We had mutual aid companies that came in on the task force, and basically everybody was pretty much gassed at the end, towards 3/4 of the way through this call. We ended up escalating it to another task force activation just to cover the town, which was very smart to do. And we got additional apparatus into our town from neighboring towns, and once we were able to start clearing stuff and picking up, then we were able to clear them.
So we are thankful to Newington, Weathersfield, and Cromwell.
Yep, and Berlin, and also the town in Talon County was our next task force to call, and they came in with a full contingent. They manned our firehouses till we could start clearing people, and then we were able to clear them.
All right. Any questions
And I'll
from
get you-
Councilor John Emanuel?
No, thank you.
Councilor Prakash?
No, I'm good. Thank you.
Mayor?
No, thank you. I just want to say that it was a tremendous undertaking, and still very thankful for our department and for the mutual aid. And it was a very horrible scene to see the family upset and the damage that was done. But we're so grateful for our volunteer fire department. And I made a point of telling the gentleman whose sibling had owned that home at that time that these folks are volunteers. They're out here and they're doing this tremendous job, and they're volunteers. And so thank you. Just want to say thank you.
Well, thank you, Madam Mayor. I appreciate your kind words, and we did speak extensively. And I was on scene till probably 9:30, 10 o'clock at night, speaking with the family, and actually myself, the fire marshal, deputy fire marshal, our detectives from our detective division, the next day were on scene, and they were able to work with the family and talk with them and able to assist them on getting some stuff out of the home. And also assisted them with getting a board up company. So nobody would get in the house and try to take anything else that was left in the home.
Thank you, Assistant Chief. Moving along, ambulance, Joe Graham,
Good evening.
good evening.
For the month of April, we had 264 calls. Year to date, 1,274 calls. We awarded the bid for a new ambulance and met with them this morning, actually, to go over the bid and finalize a few things. We're just waiting on the chassis to come in. There's a back order through all of the major manufacturers because of the microchip shortage. But once that chassis comes in, within 3 to 4 months, we should have our new ambulance. So we're looking forward to that. And lastly, I'd like to recognize all of our members. This is EMS Week, and we've had a great group of people. We're up to 82 members, and they're just the salt of the earth. Great bunch of guys and girls. They've been supporting the town and helping us every way they can. They're doing a great job. So just want to thank them all for EMS Week, and that's pretty much it.
We'll open-
This is Dave
open
Cromas.
it up
Can I
to
jump in for
questions.
one more second?
I'm sorry, Dave Promus, Chief Promus?
Yeah, can I just jump in one second? I was remiss in not thanking the Rocky Hill Volunteer Ambulance for everything they did on Saturday. They were really on top of things, and they took care of our firefighters, and they were really making sure everything was okay with our personnel. They're always working hand in hand with us, and I can't thank them enough. Thank you, Joe. If you can spread that word to your members.
I will. Thanks, Dave.
Counselor John Emmanuel, any questions?
No, thanks, Joe.
Counselor Prakash,
No questions at this time. Thank you, Joe.
Mayor?
Thank you.
Thank you.
Joe, we may have you jump back in a little bit further down the agenda, so. Police Department report from Chief Custer.
Good evening, all. Last month, we had 3,211 calls for service through our dispatch center. 34 criminal arrests for the month of April. An additional 37 motor vehicle accidents investigated. 65 traffic infractions were issued, and another additional 335 warnings were issued for the month. Our training hours were 285. In terms of staffing, right now, we presently have one vacancy due to a retirement. We're presently conducting a background on an individual to fill that position. We still have one officer who's in our field training program, and he's expected to be complete by the end of June. As I mentioned last month, we had two sergeants that were going to be retiring. One has already, the other will be officially retired in 2 weeks. So we filled those spots this morning. We'll be having a formal ceremony next week. I haven't locked in on a date yet with John, but I'm sure he'll post that so everybody knows if they're interested in attending. That will be live, by the way, in the council chambers at Town Hall. In addition to that, I do have one records clerk vacancy, and we'll be interviewing. Actually, we've already tested for the process, and through our matrix, we've eliminated all but 2 candidates who will be coming in for a second interview this week. So hopefully that position will be filled next month as well. And then the only other news for staffing is we do have 2 officers who are out on sick leave due to incidents not related to the job. One is due back this week, and hopefully the other will be back next week. No community service events to report has been the case all through COVID. However, I'm hopeful now that the restrictions are easing up, and I see Charlie's here, and we'll hear more about that. We can start initiating some of our community outreach programs that basically have been on hold for the last year and a half. So we're looking forward to that. Stolen motor vehicles have been holding steady at approximately 3, which is what we were averaging prior to the pandemic. So I think all our efforts and actions are paying off. You'll note on your graph charts that, again, there was 400 stops made in April, and I do think that's having an effect. Other than that, we had our final meeting with town staff regarding the Memorial Day Parade, and we are all set to go. And that's all I have to report.
So we thank you for putting us on the invite list for your ceremony, upcoming ceremony. And I was remiss to thank Ambulance Joe Grave for inviting us to the EMS barbecue, which I think most councilors are trying to attend. So thank you for that. Questions for Chief Custer from Councilor Emmanuel?
Yeah, just a couple. Mike, on the motor vehicle theft on the not the graph, the outline, I think the 2021 year-to-date column has to be filled in. That formula has to be put on there because it's showing 0.
Which one is it? Thefts for motor vehicle or motor
A
vehicle?
motor vehicle theft. Yeah, there's 15. Like you said, there's 3 for April,
Right.
and there's 15 total year-to-date, but the year-to-date column isn't tabulating.
Oh, okay, I got you. All right, we'll correct that.
Okay. And the other thing was, and this normally wouldn't come up to public safety, but the last council meeting, or maybe the one before, we were talking about a greenway designation proposal for the meadows. And we were talking about foot traffic and dogs. And I don't, you probably remember, 4 years ago when we were having these conversations about the meadows and locking the gate and some of the damage done to the farms and everything. So this greenway proposal has come up, and I'm not completely opposed to it. It's just that what I had raised was the possibility of additional. Dave, you want to go on mute? Chromis?
I'm sorry, I thought I was. I'm sorry. How do I do that?
You are.
So my concern was additional people going in. If this was like slowly turning into a park proposal, it sounded like, and I wasn't in favor of that because we have to keep these farms preserved in the soil. So I want to revisit because I've been down there a couple of times, and every time I'm down there, there's a dirt bike. And I just want to revisit if there's been anything that you've been hearing on violations or complaints about the meadows, dirt bikes or dogs, people not picking up after their dogs or anything like that. Have you heard anything in the last couple of years that's being a concern?
The short answer is no, not down in the meadows. We did get a little spike of motorbike activity in the sand pits with the turn of the good weather, but amazingly, the meadows, to my knowledge at least, it hasn't reached my desk, has been pretty quiet. I first heard about the Greenway proposal a few weeks ago. I'll admit I don't know all of the specifics, but I will tell you, John, I do share your concern. If the plan is to open that back up again, my feelings are pretty much the same as they were 4 years ago, and they're pretty consistent with the farmers down there. But again, I don't know what the full proposal is.
Yeah, I don't think it's going to be opening the gates. I think it's just more foot traffic with the possibility of dirt, people violating with dirt bikes and things like that. So I just wanted to raise the concern, if that does happen, if we have a game strategy to, even the next year or two, thinking about putting up cameras down there and just monitoring in case something does come up, because I know it's not the most ideal location to enforce, especially with the gates closed. But if we can have a couple of cameras set up down the road, if there are complaints arising, that might be something that we can put on the table. I just wanted to get your feeling on that. It was a concern of mine, so I just wanted to raise it just in case this does pop up.
Understood. And again, to your point, We've always acknowledged it's almost impossible to stop a real determined motorbike rider, from getting into the sand pits or the meadows. There's so many ways in there. But, the only, point I would like to make is if that greenway is going to increase foot traffic, that was a concern on the roads because of the farm equipment, some of which extends well beyond the width of the road. So that would be something we'd have to look at.
Okay, thank you very much. Thanks, Ed.
Thanks, John. Counselor Prakash?
No questions at this time. Thank you.
Yeah, Chief, we have a camera down there, but it's only at the two ends, the gate.
Yes, we do. And Jim Belanger's here. He could probably attest to this. Have we not, Jim? Those cameras have not really been reliable, have they?
No, they're offline more than they are online because everything's through wireless networks, so it keeps dropping.
Yeah, we've had better luck with the one at Ferry Park, but the gates, I know it was somewhat new technology and it's not been very reliable. So just something to keep in mind.
Yeah.
Is that something that Parks and Rec could look into if theirs is working pretty well at Ferry Park?
Yeah, I think if we could get maybe together with them and IT, hopefully we could pinpoint what the exact problem is.
Okay.
All right, great. All right, moving on to emergency management, James Bellinger.
Good evening. Last week, we developed a incident plan for the potential healthcare strike, and we were notified the day before that it was being canceled. So I want to thank everybody that was part of the planning process. Department of Emergency Management told us that they were discontinuing their ordering of PPE supplies for distributions to municipalities. They say they currently have plenty of supplies in holding that they can dole out if they need to. And they also notified us that the school emergency plans that are due November 1st, there's going to be a new template with new required annexes out sometime in July. So we're going to have to update the school plans. I had a meeting with Newington and Weathersfield Emergency Management in regards to developing of a CERT team. We started this at the beginning of last year and then got shut down because of COVID. So Weathersfield's also looking to develop a CERT team. So we're going to coordinate together in regards to developing information and building out a team and training of members. And Newington has a CERT team with 48 members. So we're going to use them to assist us to build out our teams. The last thing that I have is the Everbridge program, the CT alert system. We developed it. We've completed the dispatcher training. We're able to use it for internal staff notifications. And as of June 1st, emergency management is going to use it for townwide emergency notifications. It's a statewide system that people can sign up for. And we can put out information in regards to anything that's life safety. The policy and guidance is being written. It's going to be out by the end of the week. Information's on the town website and posted on social media. And citizens can find information on ctalert.gov. And again, we're using that as of June 1st for our reverse 911 emergency notification system. That's all I have.
So
Thank you.
Jim,
Questions from Councilor Emmanuel?
No, other than James, I'll send you some Yankee pennants for the background.
So I can put them
Yeah,
on backwards.
I see you're missing some.
I'll put them on backwards for you.
Questions, Councilor Prakash?
No questions. Thank you.
John Mayer, you wanted to?
James, I got a few messages, I think maybe text messages, and I'm not sure whether emails, saying something, you got a message, respond back with yes. So does that mean we're on the system?
That's the internal notifications. That was the test of the EOC group that we were using. So there's the public facing system, which is the emergency alerts. And with the contract that Everbridge has with the state of Connecticut, they allow municipalities to do internal notifications. So we were doing the test on the system with the EOC group.
So does that mean if you're on the test and you get those messages, then you're on the system going
Yes, sir.
forward?
Yep, we ended up putting it out so everybody gets it via email, text, and phone call.
So
Thank you.
yep, so it came through on mine as well, and I think the mayor's as well, so thank you.
Mhm.
I guess we have no questions at this juncture for you, other than I just wanted to, the school emergency plan is due when?
Yearly, it's due November 1st.
But now, this year it's due in July?
No, it's still due November 1st. They're going to be putting out new templates and new required annexes in July.
Gotcha. All right. Under old business, update from Central Connecticut Health District, Charlie Brown.
Yep, can y'all hear me?
Yep.
So my internet connection is a little unstable, so you're gonna have to forego the view of my beard. Right now, as far as the case numbers for Rocky Hill, 1,785 total cases, 123 deaths at this time. Rocky Hill is in the yellow alert phase, so we've been making good progress on the case numbers coming down over the past several weeks. I anticipate they're going to continue to go down as the number of vaccinations increase. This past week, as many of you know, 12 to 15-year-olds were opened up for vaccinations, and everything that we're seeing is showing that there's been a robust, number of folks that are actually taking advantage of that. Come the 19th, changes are afoot. Most of the restrictions that are in place as far as reopening are going to end up going away, with the one for indoor masking in certain places for those unvaccinated especially is not going to stop. Schools, places like nursing homes, hospitals, those are going to continue to have indoor masking as well. Schools, they're just saying stay the course until the end of the school year and then reevaluate prior to the fall. So that's pretty much where we stand right now. We have started at this point to vaccinate the homebound individuals in our 4 towns. We have teams of nurses that have begun to go out to identified homebound individuals to give them their first of 2 Moderna shots. That started as of this morning, and we're going to continue until we make our way through the list.
Thank you. Questions from Councilor Emmanuel? Councilor Prakash?
Thanks.
Yeah, Charlie, quick question. I don't know if you mentioned this in your brief. What percentage of Rocky Hill residents are vaccinated? If you have that data.
Hang on a second. I might be able to find it before we go. Let me just take a look here real quick. So the town percentages, I just got to bring them up, and my computer's been very slow, unfortunately.
Yeah, and also I'm thinking more in terms of the senior citizens. If we have
senior citizens have been great across the board. I think they're one of the only groups 65 and above that have reached that point of herd immunity within their age group. So we're working on the ones that are younger at this point. There's a little bit of a dip. I think the 16 to 18 group are pretty high now. And then you get to the 18 to 24 and it goes down, a little bit. But then it works its way up when you get up into the 34 to 45 and then 45 and above. They're, have seen significantly high vaccination rates.
Great. That's great to know. So my follow-up question with that is, do you anticipate, it's great that we have high vaccination rates, and that's really good. But obviously, the town is not, a sealed town, so you'll have people from other towns and other states and things like that. Do you need to have any contingency plan for like everything opening up now? And, any thoughts on like, what do you anticipate is gonna happen in terms of like cases? I mean, obviously we all hope that it stay low and they stay contained and like we're on a great trajectory and it keeps going that way. But is there anything from, in your professional opinion, like, you have to prepare for with this reopening?
Yeah, I mean, once again, I think that the biggest thing that we can do to protect all of our communities, our family, our friends, is to get vaccinated when we have the opportunity. That's really the biggest protection factor that we have. So without that, the reopening, there is a risk. It's never no risk, but it is a relatively low risk with the vaccination rates that we have in the state of Connecticut. As was told last week, we've gone over 70% of our total population has been vaccinated at least with the first shot. So, we're at the point where the risk to individuals for being hospitalized or seeing adverse events from exposure to the virus is actually pretty low. We're getting to the point to where this is going to become more like a manageable disease, which is resembling flu. But remember, flu, even in a good year, we see about 36,000 deaths a year. So, it's manageable, but there will still be people that are susceptible to this. So I think that it's getting more back to the point of quote normal, where people can go back and function. We still have to remain cautious. We're still, sequencing the viruses that we find to assure that there's not going to be some variant of this particular disease that is of higher mortality, so that we can make adjustments along those lines. So public health, I think we're starting to come back from the full-blown response mode that we've been into for over a year and a half, and we're backing into more of our surveillance that we do all the time.
No, thanks, Charlie, for all the hard work in the last year or so, and then we all hope like we are on the, upward trajectory in terms of good news and downward in terms of like all the.
Like I said, I'm keeping my finger.
Sorry, go ahead.
Joe Grave, you're mute. Did you want to make a comment, Joe?
No, I apologize. All set. Thank you.
Thank you, Charlie.
Hey, Charlie, is it coming up on time to make board appointments? Do you have board appointments, or are you going to be letting us know when you have board appointments or renewed appointments?
Yeah, our board chair, Dr. Checo, should have been reaching out to folks if you had had renewals that were coming up. Right now we have, I think, a full slate from Rocky Hill, and I think that everybody was, I believe they were already appointed at this point. I don't know for certain, but if we need one, she's going to be reaching out to the town manager, town clerk.
Charlie, is it 3-year terms or 4-year terms?
3-year terms.
3-year terms. So I think we're pretty set on at least 2. I'm not sure whether someone else may be coming due.
Okay. Does that get mentioned at council? Do we report that at council? That change out?
I think they usually send notification to myself, and I forward it on to the mayor for an appointment.
Okay, got it. All right. Let's see. Thank you, Charlie. I think if we don't have any other questions for the health district, we're moving on to new business. And in new business, we do have a state conveyance of 7.5 acres of land to the town, and I'm going to rely on staff, town manager John Mayer, to bring us up to speed. But we could continue the topic that was raised by Counselor Emmanuel on the Greenway, either under the new business or other. If there's any other comments on Greenway. So on the state conveyance, John, do you have an update for us on that or what that's all about?
Yes, I believe it was brought to the town's attention that there is some state land available and relating to the idea of when the state wanted to put in, I think it was 291. And it's actually land that was going to look like it can be used as an exit ramp and so on. So it's about 7.5 acres. So usually you have to apply to the agency that owns the land to see if they want to turn it back over to the town itself. So working with Carrie Wood, there was a 7-page application that was completed and handed in to, I believe, OPM, and then OPM distributed, found out that I think it belonged to DOT, and I believe DOT does not have any plans with it. So then it made it to the legislature as a bill with other towns requesting land and so on. So right now it's, I believe it's at a committee level being reviewed to be sent on to the full House and Senate for approval. And as of this point in time, about all we know is it's 7.5 acres, and really the price to be determined whether it could be conveyed over for $1 or for some, hopefully some nominal costs. I think the only thing is that if we receive it, it has to be used for municipal purposes. So right now, I think we're on hold, waiting for approval from the state and then a price tag on whether the town wants to move forward with this and purchase it at that price. So,
right, so an offer to be made back to us to be rejected or accepted by town council.
Yes.
John, Councilor Emmanuel, does that have to come, the offer first have to come to this committee first to make a recommendation?
No, the only reason, I mean, normally we would never see something like this at this committee, Ed. The only reason I asked that it be brought up is because there is some mention for the ambulance headquarters. And, you know, John's correct. It could be conveyed to the town for municipal purposes, which I'll tell you guys, I'm totally supportive of. Whether it's, you know, for an offshoot of the town garage, for a Western garage or whatever. The reason I brought it up, or I wanted to have it brought up, was because just because there is an opportunity for land to be conveyed to the town for municipal purposes doesn't mean that it's an ideal location for a new ambulance headquarters. If you look at where this is situated, if you walk 100 feet up northwest, you're in Weathersfield. So you're basically going from the southeast of town to the northwest part of town. And you know, I just want to make it clear, I'm not opposed to a relocation of the ambulance headquarters. I think it was there temporarily 40 years ago when that station was built, knowing that eventually it would go somewhere else. And I just think there hasn't been opportunities available over the last 40 years. Joe, you remember historically Marty mentioning 30 years ago about wanting to move out. So this has been going on, you know, off and on for many, many years. I had been saying off and on again that a more centrally located plot of land would be ideal. And if we look at West Street, for example, around the state library, around the veterans home, and around the research facility, there's got to be 1.5 acres to 2 acres that they would be willing to move over to the town for an ambulance headquarters. And who wouldn't in that area, who wouldn't want an ambulance headquarters? So again, I'm in support of this being conveyed to the town. If there's continued conversations about an ambulance headquarters at that location, I'm not in favor of it. So I just want to make that clear, and that maybe, Ed, politically, we could have Carrie and Matt pursue West Street for the ambulance, because you're looking at centrally located between Route 3 and Main Street, and right down the street is the highway. It's very accessible, and I'd be very surprised if the state said, no, we're not interested.
So that's why I asked Joe to hang in there with us. Joe, I don't know if you have any comments you'd like to make at this juncture about that potential move that you're thinking about?
Sure. Well, I understand your concerns, John, but when you look at the whole structure of the town, how much the West End has exploded over the last 30 plus years, between the hotels, the Sheraton, the Marriott, the other new hotel that just went up. Out of 9 assisted living facilities and convalescent homes we have in town, 6 of them are on the west end of town, and that's a huge majority of our calls. It's a huge elderly population up on that end of town, and that's all of our longest response times, let alone school swimming's always been way out into the woods. Unfortunately, we don't go out there very often during the summertime, but the majority of our calls now are on the west end of town. Very rarely are we getting called on the Southstein Highway for most anything anymore. So between all of the assisted living facilities, the convalescent homes, the condo complexes, and all of the major apartment buildings also, everything is up on the west end of town. And that's, again, like I said, the majority of our calls. And our response times, while they're good, they could be much better if we could relocate in that area. So getting onto the highways is not a problem. We can go north into Weathersfield to come 91 South. We can cut down to the Silestein Highway through Waters Ave and also Elm Street, and then 91 North or West Street. We can go either way also, 91 North or South. So I have to disagree with you as far as the ideal location. West Street still puts us on the east end of town, and we're still far away from the majority of our calls. And every intersection we go through, every traffic light we have to go through, it's a hazard for all of our responding units, the paramedics and the ambulances. So I know it's on the north end of town, but it's more centrally located to our call volume than anywhere else in town.
Yeah, no, I can understand that, Joe. I mean, if you look at the overall map of Rocky Hill, West Street around the state library and research facilities is centrally located, and you're closer to 91, you're closer to Route 3, and I just think it's more, you know, with regards to response times, it's more advantageous to be in that area rather than the northwest part of town, where you might have to have calls again, because now you're going to be having longer response times to the east side of town. And especially we have a lot of elderly people on that side of town that rely on quick response times. If there's any way that you could, as we have this discussion, if there's any way that you could put together kind of like a map with
the pins.
The pins where you have the responses in the past, like maybe 2 years. And I know there's thousands, but you can probably do it on the computer based on the addresses. And, you know, we can see a plot map of where the clusters are, because I think that would help in going this route.
I have tentatively done some research, but I will definitely get actual numbers. But like I said, the majority of our calls are at the assisted living facilities and convalescent homes, and they're all up on the west end of town. But again, let me get definite numbers, and yeah, we'll put together a program and figure out where everything is, and I can actually show you the clusters along all the complexes.
Okay. Thank you.
Councilor Prakash?
He's on mute.
You're still on mute. So Joe, just while,
Wasn't one, sorry about that. No, I have no questions. Sorry about that.
Yep. Joe, Graham, you don't have any hard, I mean, this didn't come up specifically because of ambulance or did you make the request or?
For the land itself,
Yeah,
yes, well, we were researching it and we've been seriously looking at different locations for the last 2 years. I've been trying to push and we've found some buildings that were vacant up for sale. They really didn't meet our needs and their locations weren't anywhere as near as good. When one of my people were able to locate this property, we're in contact with the mayor and explained the situation, explained it to the mayor, who was able to get in contact with Kerry Woods, and both of them were brought in. and
both the state rep and the senator, you mean when you say both?
Correct, I'm sorry. And we've had a lot of pitfalls along the way, and there was a lot of potential locations that we had to review first. And for one reason or another, nothing has come to terms with being ideal for us. So this was the first area where we felt it would be a great location. If the state is willing to assist us with the opportunity to get the land, and then we can go from there.
And you were going to do a fundraiser. I think it came out at one of our meetings. You were looking to try to raise some funds for your efforts. Have you done anything in that realm?
We have not yet.
Okay.
Joe, when did this first come about?
The state property?
Yeah.
Probably 3 months ago. And there was some talk about it, some discussion, and then once it was brought to the mayor, we discussed it for a while and got Kerry involved, and then we didn't hear anything back for a while until about Wednesday that there was going to be a hearing on Friday.
Yeah, and that's the issue I have is the timing of that. I mean, we hear about this on Tuesday, Wednesday, and there's a hearing on Friday. I just have to question the whole communication process.
Yeah, well, again, part of the issue with that is, like I said, we've had so many, not so many, but we've had probably a half a dozen to a dozen opportunities that we've gone around looking at. And for one reason or another, we just looked at them and said, this just is not going to work, whether it was the location or the structure itself. So we've kind of been, I don't know what the word is for it, but we've tried not to build up our hopes on getting any of these locations until we can actually work things out and say, yes, this would actually work for us. Even with this state property, I guess there was some issues as far as who actually owned the state property under the state, whether it was the state of Connecticut we had to apply to. That ended up being the DOT, Department of Transportation, that owned that property. So it had to go through them first. And jumping through all the hoops, everything was unknown up until Wednesday for us, that it was even going to be a possibility. So, and it still is. We don't know how they're going to rule on this. So I don't know if it's premature to bring it to the council or if we're behind the 8 ball and bringing it to the council. There's been so many opportunities that we've had that have just been like, nope, for one reason or another, it's not going to work out. So.
Well, I mean, I think, not necessarily, not you, but I think the idea should have been brought to the public safety when it arose, just as a possibility to discuss back then. But, okay, thank you.
John, did you want to say something, John Mayer? So you leaning in.
No, I was waiting for Prakash to unmute himself, but he's bringing up a crescendo of anticipation.
No, I think it's a good idea, Joe. If you get us that plot map, like that call, plot the calls out geographically, like Councilor Emmanuel was asking for, that would be very helpful for us to understand, especially if you get serious about any of your options out there. Hey, John, I think that land we may be getting more farmland back. Didn't that get eminent domain taken from a farm? That was a farm.
You want that one, John Emmanuel?
No, but I mean, that's actually a good question. Is that zoned? What's that zoned? John.
Well, I think it's heavily wooded now. I don't know how good the forest is out there, but I'm not sure what it's zoned for, but there's quite a bit of trees growing on that property over the years.
Okay.
Okay, and again, just because Councilor Emmanuel brought up the Greenway, kind of in a segue over there, Chief Custer, I think the biggest concern that we were hearing at council was that during the winter, walking those roads was pretty good, pretty easy, and pretty safe. But when they start to spray, their qualified list of chemicals that they can put down is extensive and harsh, and needs both distance and time for people to be away from them. And so those farms are not all organic.
That's correct.
And that may add a little bit to the safety factor, as well as the wide load truck and farm equipment movement on that road during the cultivating season, I guess. Right.
Especially during.
We do have complaints kind of coming in about, big dog owners don't like to keep their dogs on leash, and the little dog owners do. And so, the cattle ranchers against the sheep herders, it's kind of, when it was active during the winter, I think that was kind of some complaints bubbling up, but it's almost impossible for you to be there for that in any way with an animal control officer or anybody.
Well, I think it's just a designation. There's an organization at the state, I believe, that awards greenways to walking trails and so on. So it's just getting a title put on it. Maybe it will pop up into more walking periodicals and so on. And I think there was some benefit that if you might be designated a greenways, there's always possibilities that you could maybe get some grants to improve it. But I don't think it was going to increase it drastically, as more just designating it, giving it a designation like there are throughout the state. The real problem is going to be when they finish the Route 3 bridge, so that people can walk or ride their bikes over that. That could increase traffic through the meadows.
Yep. I agree with Councilor Emmanuel. I was there when we voted for the gate and the signage and the camera to be put on and to control that for the residents down there, right? Every neighborhood has a different set of resident needs. And so that was there, and I appreciate that the Greenway is a positive thing. Nobody here is against it, but I think it would be more helpful if we got the farmers together with the hikers in some way, or at least the folks that are the Greenway proponents, and maybe there's a midway or some type of way they can come together and give us a report down the road. So John, we'll see if we can bring that together, Councilor Emmanuel. With that, do I have a motion to adjourn?
Motion to adjourn.
Second.
All in favor?
Set.
Afternoon, everyone.